Hey everyone, it's Dr. Mike, and I'm back here again in our Cracking the Code tips series. And we're going to talk now about how to price MET services and stop losing money every session. And folks, the most important thing is, do you know how much it costs you to deliver a medical exercise training session? What are your expenses? Gas, tolls, insurance, not necessarily your time, but the expenses that you're putting out there to deliver the service. So if you don't mind, let's talk a little bit about how to price your services. Price your services based on cost and value. How much does it cost you to deliver the service and the value you're providing? And folks, the value you're providing is function. You're giving these clients the ability to function. Now, physical therapy has done a great job getting them to a minimal level of function, or occupational therapy. Now you want to take them back to full function. How valuable is that for an individual? What does undercharging look like? Undercharging looks like every time you see a client or you see clients during the course of a week, you're always running short on what you need to do or what revenue you need to cover your expenses. Number three, what happens when you base your pricing on your competitors? You're always competing with them, folks. And here's what will happen. A competitor drops their price, you drop your price. Folks, eventually you hit rock bottom where the money you have coming in isn't enough to cover your expenses. And every month you're running around chasing your tail or chasing clients to get more revenue in the door. Or maybe you have to now dip into your savings or go out there and find another job. So you have to price your services appropriately. Next, what pricing says about your professionalism. If you're pricing really low, it's saying that you're providing a low level of professionalism and a meager level of function or functionality that you'll give to your client. So you have to start looking at your pricing from the standpoint, does it reflect back on me? And then lastly, what do your clients think about pricing and outcomes? Folks, if you're able to get a client to the point that he or she, after a knee replacement, is able to walk down the aisle with his daughter to give her away at the wedding, or maybe able to go on a vacation with the family and walk on the beach after a hip replacement and they were having some problems with strength and balance after physical therapy, think about what that's worth to them. And they're looking at the outcome. Here's a question I ask everyone. If you don't mind, think about this. Why do clients come to see you? In their words. We did this in Victoria, British Columbia years ago with a friend of mine who owned a medical exercise training clinic up there. We were shooting a portion of the MES there, and I was there for a few days, and I asked a number of the clients coming into his facility why they were coming in. It's interesting, folks. Universally, they gave me the same three answers. They functioned better, they had less discomfort, and they had more ability to just do things and more strength. Think about that. Think about it. That's what these people told me. So what this gentleman did, he included that in his marketing brochures and flyers. And guess what? People came by the droves. Ask your clients what you do for them. Why are they coming to you? Use their words, not your technical terms. I had an MES tell me the other day, well, they come to see me because I put together safe and effective exercise programs. A client's never going to say that. A client's going to say, because of coming to you, I'm now able to climb the stairs at the church. Because of coming to you, I'm able to go out shopping with my daughter. Because of coming to you, I'm able to do something else. So do me a favor. Price based on the outcomes you're producing. And those outcomes are invaluable. Now, don't break the bank on clients, but certainly make sure that your prices reflect your level of professionalism and commitment to your clients. And please remember this. Medical exercise training isn't just about the training session. It's about the education and it's about the follow-up, which means communicating with the doctor, therapist, or chiropractor. That is mandatory for the fee that you're charging. Now, with that, please don't forget about our Cracking the Code webinar series. It's a free webinar series where we provide practice building tips. It meets every Friday at noon Eastern time. You can go over to crackingthecode.net to get registered and to see recordings from past sessions. Folks, I guarantee you it'll make your practice better if you incorporate some of this stuff. Now, also remember, we're announcing a new course, our Essentials of Medical Exercise Business course. This is a course specifically designed for the medical exercise or medical fitness professional that wants to take their business to the next level. It's a one-day workshop. We do this in person. I'll be traveling across North America doing this course. And please, if you would, come over to crackingthecode.net to get more information about it. This is a course you need to build your practice. It's not about exercise protocols. It's not about exercise techniques. It's about how to set up systems, how to communicate with medical professionals, how to market your practice, how to price your services. And folks, I guarantee you it'll make a difference. It's based on what we've seen in 31 years helping medical exercise professionals around the world build a profitable practice. So with that, we'll see you on Friday. Take care. Don't forget, go over to crackingthecode.net to get more information.